Hi, today's topic is going to be one of the most important topic because this is something that has changed my life and I had to, choose about the branch. I was very nervous. I had to do a lot of research and I had no idea. I had to go through a lot of YouTube videos. I had to contact a lot of people and, try to understand whether the branch is right for me or not. So, yeah. So today we are going to talk about pharmacology as a PG branch and why I chose pharmacology. When I'm making this video right now, I already completed my MD Pharmacology, and if I think back, choosing this branch was maybe one of the I wouldn't say the most difficult, but I think I had to think a lot about it, and everybody does when they have they come this stage of their life. It's one of the most important decision in your life, and I think many of us do tend to be very much confused, and so was I. And hopefully, I'll be able to clear that doubt when it comes to pharmacology. Many of you must be wanting to take pharmacology, and I get a lot of questions about taking pharmacology as a PG branch. Tell me about the colleges, how do we choose the colleges, and a lot of the questions regarding that. When I was an intern, I actually had no inclination towards any branch. I saw how hectic the clinical branches I worked on almost all, in the all departments. I was like taking positive, negative, like that, which branch I might take, which branch I might not take. And so that I found that clinical branches are very hectic, and I don't think it is exactly due to the workload. It is also related to the toxic nature of the people who work there, the toxic nature of department and dumping the work, and the doctor patient ratio is not very ideal. So I just straight away I stopped that. I was like, I'm not going for clinical branch, and that is what you should also be doing during your internship. You should be able to at least figure out whether you want a clinical branch or not. So I did that. I was sure that I won't be taking a clinical branch. What remains are paraclinical branches. After I finished my internship, I did work 2 years in neurosurgery department, and I also worked in PHC, which was kind of clinical setup only. And my belief become more stronger that I don't want to be in this clinical setup, and I didn't want that much of hectic nature of the branch, because I had a lot of other things going in my life. I had content creation. I like to go out and play in the evening. I like to focus on my fitness. I do gym a lot. Those are the kind of the extracurricular activities or the personal life, you can say, or the work life balance that you don't get in clinical branches. So what I wanted was a branch which will give me all that, all my hobbies, all my passion. I'm supposed to be able to balance that with the branch. And also, when it comes to choosing the branch, I wanted one branch that could be, there has to be some growth potential. That I don't want to be like, I take the branch and it will be stagnant. I wanted something that would give me a growth. There would be like a lot more challenges, but not really in the clinical setup side. Okay, somewhere else, maybe research, like that. That's why I came to a conclusion that I want to do pharmacology, because pharmacology doesn't have night shifts. Pharmacology is 9 to 5, so I get time after I finish my 9 to 5 job. I can do my other activities, which is like playing or shooting content sort of activities, which I cannot compromise on. Or so if you are someone who cannot compromise on your hobbies or your work life balance, then you should not be going for clinical branches. I think paraclinical branches are more suited for you. And pharmacology to that is that it doesn't have a night shift. That positive aspect of it, that it doesn't have a night shift. We have done internships, we have done night duties. How night shifts can mess up your health, and I just feel it is not worth it. I really never got the idea of doing night shifts and messing up your health for that. No amount of money can convince me to compromise on my health and sacrifice my sleep for that. So moving on, I did not actually find pharmacology that interesting during MBBS. As a matter of fact, I did not study as much during my MBBS because I was bit distracted, you can say. So I wanted a branch which would give me overall knowledge. I wanted to make up for the time that I lost during MBBS during my PG. So I wanted to learn a lot. So that was my main focus. And I thought pharmac, as being a holistic approach to medicine, you can learn a lot about the drugs, their mechanism of action, their indications, and almost everything is compiled in one subject. So that increased the potential of learning and gathering that that the knowledge which I could not do during my MBBS. It was another aspect that I thought that pharmacology can help me, and it did. Of course, it did. And now that I finished it, I do feel very glad that I took pharmacology. Though I had to study a lot, but I took it in a positive way, and I really enjoyed reading, during my residency. When you finish pharmacology, there are a lot of career aspects or career prospects, you can say. You can either go in teaching. It's said that teaching side is saturated nowadays. So if you get a chance in teaching, life can be good. Okay, so teaching is one aspect. Then you can of course go in pharmaceuticals. So if you are someone who is staying at a place or get admission in a college which is close to pharmaceuticals, it is well and good. I mean, it is better. So yeah, there are a lot of career prospects. You can go in teaching. There are pharmaceutical industries, there are programs. And one more aspect of pharmacology that I like about it is the research. You can learn a lot about research. You can do a lot of studies. You can be involved in clinical trials. And during residency, everybody has to do thesis, everybody has to do a research paper and all that. And all the technicalities you don't actually learn in clinical fields, you can definitely learn that in pharmacology. We get to learn a lot about randomization, clinical trials, good clinical practice and all that, which is essential course if you want to answer any of the residency or any of the PG exams. You tend to learn a lot about research. You tend to learn a lot about the tools that will make you well equipped for taking on the research part. And of course, there are national programs where pharmacology is needed in hospitals if you want to make antibiotic stewardship, what you call it, or programs regarding, especially hospital pharmacy and all, antibiotic policies, all that stuff. Clinical pharmacologist or pharmacologist is definitely needed, or it plays a key role in that. So there are different job prospects. Hospital pharmacy in charges are mostly pharmacologists. So basically, they form the backbone of medicine prescribing policies, and they can advise people how to prescribe, rational prescribing, irrational prescribing. All that is taken care of by pharmacologists. Okay, so there are a lot of job prospects. So when it comes to that, if you're worried whether you'll be having job prospects or not, don't worry. You have a lot of field you can divert to. You can go in a lot of directions, so it won't be a stagnant place. Now, the things that you need to be careful about while choosing this branch is there is no doctor patient contact. So if you are someone who wants this doctor patient interaction, and you want that satisfaction, then pharmacology is definitely not for you. Even in PSM and all, you get some kind of doctor patient interaction and that treating job satisfaction. But here, if you want that interaction, then it is not for you. But if you are someone who is already tired of that, I mean, the burden that comes with the clinical setup, a lot of stress, you're already stressed and you don't want that, you are kind of want a bit calmer life, then definitely pharmacology is the branch for you. Also, another aspect, pharmacology does have a lot of presentations and communication skills. That part plays a very important role. So if you're someone who's introvert, then this branch can be a bit challenging for you. But listen to me, even that is actually challenging for almost everyone. The whole point of doing PG is that you learn during that time. Okay, so even if you're introvert, don't worry about it. You can always, during PG, you'll be trained for that. You should always take that in the positive aspects. You should always take on that challenge present on your local stage. So when you are done with PG, you can go out and do presentations, you interact with people, you can learn that in even conferences. So that is not going to be as big problem. But yeah, if you are really someone who has stage fear and who's like a really introvert, and I don't want that extroverted part of field, then pharmacology, I think, might not be a field for you. But then when we say that all the PG branches have that doctor patient interactions, and you have to interact at some level, so being an introvert can be challenging when it comes to all the fields. So I think should take that aspect and see when it comes to choosing a branch. So as such, if you're that introverted, you can always not go for pharmacology, because it does involve a lot of presentations, interactions with other doctors. And for job prospects also, you'll be working in pharma industries, you'll be working in programs, you'll be working in clinical trials, so you'll have to interact with other people because you'll be working as a team. I do get asked a lot about the how to choose college for pharmacology. So when it comes to that, there are certain factors you need to remember. First thing, if it is in tier 1 city, or a city where it is surrounded by pharmaceutical industry, best. Okay, that will be your first preference. You choose a area or college which is surrounded by pharmaceuticals. So whenever you're doing your PG, you can get internship during your time. If your college has affiliation with the pharmaceutical industries, which often it does, if it is situated in that tier 1 cities or surrounded by pharmaceuticals, then definitely the internship can be a growing step for you. To definitely choose that as your first criteria when you are doing pharmacology, or when you're choosing college for doing pharmacology as PG. Secondly, the college should have a working and functional animal lab, because animal experimentation, learning how to handle animals is going to be one of the important part you learn during your residency, because even in your final exams, that is practical exams, you do have to handle animals that rats or rabbits. You do have to handle them, and if your college doesn't have an animal lab, then that can be a setback for you, because you won't be able to learn. The hands-on practical experience won't be there. And I'm talking about animals, if you are someone who doesn't like to handle animals, you are scared of rats, or you're scared of other, you don't want to handle them, then pharmacology should stay away. As such, there is no big experiments done right now. Only thing is, you do need to handle at least for at some point of time, so that you can learn how to handle them, how to feed them. No big experiments, just the basic stuff. Okay, so even if after that you are really that scared, then pharmacology can might not be for you. And other main aspect is, do find out from your seniors who have done PG from that college. Do find out whether the college is a research oriented college or not, whether people there are doing research, what kind of research is going on, and whether the college is associated with clinical trials. If that is there, then best. You can always get involved in clinical trials and get their experience early, which will definitely prove useful after you're done with your residency. Because remember, the PG is just a starting step or stepping stone. Real journey starts after you are done with the PG. So you do have to gather all that skills. And when I chose pharmacology, I did get some resistance from my parents also, that this is not something known. So that kind of stigma, when you're choosing pharmacology, stigma part, of course there will be a lot of stigma, that it doesn't have that doctor patient interaction, so people don't exactly know what pharmacology is. So you will have to explain a lot that what pharmacology is when a general person is asking you. You might also face some discrimination from your own colleagues means the friends who are working from in the other department. Nowadays it is not as much, because people know how much all the fields have the weightage. I was talking about pharmacology on my Instagram, and I made a lot of videos about why it is important, and why paraclinical fields are also gaining that weightage now, and they're becoming important part of. They are also important part of the setup, whole medicine setup. Then I get a lot of comments like, you chose pharmacology only because your rank is bad, and paraclinical branches are only chosen by people whose rank is not so good. It's not by choice, it's their only option. That is the kind of things you should be prepared for. But then it is on you. You should not be paying attention to all of this kind of comments. It's definitely going to be the the direction you want to go in life. You want a life that is going to give you that work life balance. You want something will give time for you to chase other things in your life, the other hobbies which which are actually the food for soul. That part you can't skip. So if you want that kind of life, then pharmacology is a very good field. I have chosen it. I have completed my MD also, and I'm not regretting it. That I think that is going to be one of the best decisions I ever took by choosing pharmacology. And I am doing a lot of things now. I am also focused on my content creation. If you want to check that out, do check out my Instagram page also. I'll give the handle here or in the description, so you can check that out. I make regular content about paraclinical field, how to choose PG branch, and I also made a detailed video regarding choosing PG branches. So that I'll put in the corner here or here somewhere, so you can check that out. So I think basically I have spoken about everything: the stigma, the good parts about it, the work-life balance it provides, and the scope regarding pharmacology. Overall, pharmacology is a very good branch. You get a lot of balance when it comes to learning. It has a lot of overall learning. It involves a holistic approach towards medicine. And one more part about it is, if you want to go in private practice, definitely pharmacology is going to be one of your best branch, because it gives you the real knowledge about medicines or drugs and how to prescribe them. There are a lot of concepts when it comes to rational prescribing. That is there are a lot of concepts like chronopharmacology. When I was learning pharmacology, when I was doing my residency, I've seen a lot of irrational prescribing in the other fields. So there is a lot of lack of knowledge when it comes to rational prescription of drugs, and how important that is when it comes to that, because we have a lot of antibiotic resistance and all that growing up in time. So that is going to be one of the main part. If you want to go in private practice, having pharmacology as a PG is going to definitely boost your prescription skills and your overall skill as a doctor. So that part, if you're someone who's looking to take pharmacology for PG, I think you should definitely go for it. There are a lot of positive aspects. You won't definitely regret it. You definitely can shape your life however you want. Okay, I hope this video might have given you some clarity when it comes to pharmacology as a PG branch. And if you have any doubts, you can always put in the comment section. I will definitely answer it. And if you want me to make other videos or other topic, you can definitely put it in the comment section, and I'll make sure I take that up for my next videos. Okay, until then, tada.